Hi, I'm Dr. Tony Mork, endoscopic spine specialist. Today I'd like to talk about a situation that I see fairly often in the office, particularly in people who are maybe older than 70 years of age. And of course, as an endoscopic spine surgeon, I think we're all trying to do the least amount of surgery possible. But what do you do when you're faced with a disc herniation or protrusion of considerable size, as well as stenosis? And the typical response is, I think most of us would like to do one thing or the other. I'm going to show you when I did one thing and really probably should have done both at the same time. In this case, I have an 81-year-old very active woman who showed up with progressive leg pain in spite of conservative therapy and a few epidurals. So let me show you her MRI scan and you be the judge about how you would start this case. As you can see, there's a large protruding disc at the L3-4 level, which certainly would account for her symptoms, as well as we've got some overgrowth of the soft tissues in the spinal canal posteriorly. If we look at the latter, we can certainly see a broad-based protruding disc, as well as some very thickened ligamentum flavum and some overgrowth and hypertrophy of the facet joints. As I go through this, we can see that there's also some fairly good-sized disc protrusion there, and it is biased to the left-hand side. Even trying to avoid doing some additional surgery with some persistent symptoms showing up after the discectomy, I felt that this may have been better treated with both a transfemoral discectomy as well as a small laminoforaminoplasty using a Metrex set. I hope today that I've shown you the benefits of doing two approaches to two different problems on the spine using the absolute minimum of surgery, using a transfemoral discectomy as well as a small laminoforaminoplasty for a combination treatment for disc herniation and stenosis. Thanks very much for watching. Feel free to contact the office or look at my YouTube channel or www.tonymork.com, and I really appreciate you taking a look at this. Thanks.